From mid-June to early August 2025, Foshan City in southern China's Guangdong province has been experiencing a severe chikungunya outbreak. To date, more than 7,000 to 8,000 confirmed infections have been recorded, the majority in Foshan, which accounts for over 98% of the province's cases. The outbreak began with an imported case identified on July 8th, followed by rapid local spread. The daily peak occurred around July 19th, with 681 new cases that day. Weekly.chinacdc.cn. By the end of July, there were over 4,800 cases, reaching nearly 5,000 on July 26th, with 87% of cases concentrated in Shunda district. The classic symptoms, fever, severe joint pain, and rash, are present in about 80% of those infected, lasting from a week to months or even years in some cases. Despite this, there have been no serious cases or deaths so far. All patients have mild or moderate symptoms. Main actions taken by Chinese authorities: intensive vector control, drones to locate breeding sites, application of larvicides and insecticides, and elimination of stagnant water in homes and public spaces. Innovative biological methods: release of fish that feed on mosquito larvae, 5,000, and the use of predatory mosquitoes, Toxorhinchites splendens, whose larvae consume Aedes larvae. Isolation of patients in hospitals with beds protected by mosquito nets and hospitalization for at least 7 days. Initial home quarantines were later lifted due to the absence of direct human-to-human transmission. Strict monitoring of the population, fines of up to 10,000 yuan or power outages for those who fail to remove stagnant water from containers and plants. In addition, Chinese Vice Premier Liu Guozhong visited Foshan in early August, calling for intensified port control measures, epidemiological surveillance, and the elimination of breeding sites. International situation: Hong Kong reported its first imported case of chikungunya since 2019. A 12-year-old child who traveled to Foshan between July 17th and 30. She developed a fever, rash, and joint pain and is in stable condition. The World Health Organization, WHO, and the U.S. Centers for Disease Control and Prevention, CDC, have issued travel advisories for travelers to Guangdong province and other countries with current outbreaks. Context and risks. Chikungunya is not transmitted between people but by Aedes aegypti and Aedes albopictus mosquitoes. There is no specific treatment or vaccine available in China. The U.S. has 2 approved vaccines, but one has been suspended for people over 60 due to safety concerns. The disease is rarely fatal, but it can cause long-term complications, especially in the elderly, young children, or people with chronic illnesses. Recent developments. Reports as of August 5th indicate a gradual reduction in the number of new cases in Foshan, approximately 2,892 cases in the week ending last Saturday, a decrease of 48 cases compared to the previous week. Transmission is already slowing, but it remains a high-risk period due to the rainy season and hot weather. Conclusion: by August 6, 2025, the chikungunya outbreak in China will total between 7,000 and 8,000 cases, all mild, concentrated in Foshan, Guangdong. Authorities have adopted aggressive, multidisciplinary measures, from drones to predatory mosquitoes, and international monitoring is ongoing. The expectation is that even though the number of new cases is declining, the coming days will be crucial to prevent a resurgence of intense transmission.